All wildlife is in peril. They're trying to survive in an environment that we keep changing. And some can't. And some will and are perishing.
My name is Kim Scottolini. I'm a clinic intern here at Audubon Center for Birds of Prey.
My name is Claire Robinson. I'm a volunteer.
My name is Samantha Little, and I am the Audubon veterinary technician.
Diana Flint, and I'm the rehabilitation supervisor here at the center.
When the bird comes in, they get a full exam, just like you would at a hospital or a vet clinic. The animal gets a full exam head to toe so that we can determine what their injuries are and how best to treat that patient.
The red shoulder that came in flew into a window and fell to the ground, and then he was left with a fractured clavicle. He was also missing his tail feathers. He also had parasites. So that's why we were giving him the injection of ivermectin.
Oh wow, that's new.
It's a secondary wound that he got when he was in here, probably from flying into a kennel. So we put Silvadene on his wound. If they're crazy and they don't really calm down, some of them have gotten fractures just from flying around in the mew or the kennel. A lot of the birds that we get in are dehydrated, so we usually give them oral fluids. If they're really dehydrated or really emaciated, we give them sub-Q fluids. It's short for subcutaneous, it's right below the skin. We can pump in as much fluids as we can. I think my first day that I started working, I had to grab up like an eagle, and so that was very scary, but I was walked through it and I've got used to it.
These birds are wild birds. Unlike having a pet animal that can recognize that you might be able to help them, you can comfort them, and they understand that you're trying to help. These birds always want to get away from you. They don't lose that wild instinct. Handling these guys is very unique. You have to be strong-willed.
It's actually very cool to say that I can work with raptors. It's very scary though. It was scary at first.
Hand feeding can be very traumatic. They don't know what it is that we're doing. They just find it scary that we're stuffing things down their throat.
Do want to have their diet mimicked in the wild. Like if you have barn owls in rehab, barn owls, they're kind of exclusive for rats and mice. They don't eat anything else. They're rats and mice birds. So we want to feed them rats and mice because that's what they're used to in the wild. The flight section, there's lots of room, and they're encouraged to fly back and forth to get them used to being outside because they've been in a controlled environment.
The screech owl that we have in our house is Tony, and Tony had a neurological issue to his nictitating membrane. It's the third eyelid in the screech owls. The neurological issue decreased the amount of tears that Tony could produce. That eye became very, very dry. So by suturing those eyelids closed, it actually helped lubricate that eye and cause less pain so he could live a happy life. When we get a bird in, we do fecal exams and blood work on those birds to help determine what it is internally that might be going on. The fecals help us in determining whether or not there's an internal parasite that we can treat, and the blood work helps us determine if that bird has a blood parasite, is anemic, may have an infection internally. All these things can help steer us in the right direction when helping these birds recover from their injuries.
So this bird was found after being hit by a plane, and when he got hit, the tip of his wing was damaged, the metacarpals. The bone there was exposed, and there was an artery that was severely affected, so part of the wing had to be amputated in order to save his life.
We bring all of our birds to Winter Park Vet Clinic, and Dr. Hess and Dr. Newman do most of the surgeries. He had to have a second surgery because a bone was starting to stick out of the suture, so he had to get it clipped back. It was really nasty. He had to get his bone basically clipped back and then sutured back up again. He puts the mask on, and I'm just holding him and waiting for him to kind of, like, you feel him kind of just like go limp almost. We still hold the feet during the surgery just in case he does come out of it, because that could be dangerous.
If a bird can't be released, we have about a 40% release rate, sometimes a little bit more than that. The rest of those birds usually either die due to their injuries, either come in and die shortly after coming in, or have to be humanely euthanized because they would not be able to be released. Every time we get a bird in that can't be released and has to be euthanized, that's a tough call, and it's something that we make every day, and it's also something that we don't take lightly.
We've built a reputation of being specialists in our field. We average about 60, 65 bald eagles a year, and this year already we've already received over 70, so it's been a busy eagle year.
This eagle, because we do have potential placement for him, was recommended to be saved and treat his injuries so that he could go to one of these facilities.
Over our 34 years, there has been over 17,000 birds brought through our door. Something happened along their life, and we're there to give them a second chance. The thousands of birds that have crossed through our door and been released back to the wild, does that have an effect on the population? It has to. We would like to see visitors leave with a greater appreciation for not only birds of prey, but for all wildlife, and for maintaining and keeping a healthy environment for them to survive.